Picture this. You're walking through an old garage, maybe a construction site, or even your backyard. Everything seems normal until suddenly you feel a sharp stab in your foot. You look down, and there it is. A rusty nail sticking out of a piece of wood, and unfortunately, it just went straight through your shoe. Most people's first reaction isn't about the pain. It's the panic. Wait, rusty nail? Isn't that how people get tetanus? For decades, we've heard this warning from parents, teachers, and doctors. Step on a rusty nail, and you could get tetanus, a disease so serious it can lock your muscles and even stop you from breathing. But here's the surprising truth. Rust itself isn't actually the real danger. The real threat is something far more invisible and far more terrifying. And to understand why this tiny injury can become life-threatening, we need to talk about one of the most dangerous bacteria on Earth. It's called Clostridium tetani. This microscopic bacterium lives in soil, dust, and animal waste basically everywhere outdoors. It produces incredibly tough spores that can survive for years in harsh environments. And when the conditions are right, those spores. Now, imagine what happens when a nail sits outside for months or years. Rain hits it. Dirt builds around it. Animals walk past it. The metal corrodes and rust forms. That rusty nail becomes the perfect place for dirt and bacteria to collect. So when someone steps on it, the nail doesn't just puncture the skin. It pushes all that contaminated material deep into the body. But the real problem isn't the nail. It's what happens inside the wound. Tetanus bacteria love environments where there's very little oxygen. Doctors call these anaerobic conditions. And a deep puncture wound, especially one caused by a narrow object like a nail, creates the perfect oxygen-poor pocket beneath the skin, a powerful neurotoxin known as tetanospasmin. This toxin travels through the nervous system and begins attacking the signals that control your muscles. But then the toxin spreads. Muscles start tightening uncontrollably. Your jaw locks. Your neck stiffens. Your body begins experiencing painful muscle spasms that can last for minutes at a time. This is why tetanus earned its terrifying nickname, lockjaw, and it gets worse. In severe cases, the spasms become so powerful they can break bones or tear muscles. Even breathing becomes difficult because the muscles that control the chest begin to seize. Before modern medicine, tetanus was often a death sentence. In the 1800s, mortality rates were extremely high. Even small injuries, a splinter, a nail, a cut from farm equipment, could lead to fatal infections weeks later. Doctors at the time didn't even fully understand what caused it. Patients would arrive with locked jaws, rigid backs, and uncontrollable spasms. There was little anyone could do. But today, things are very different. Thanks to vaccines, tetanus has become extremely rare in countries like the United States, the United Kingdom, and Australia. The tetanus vaccine works by training your immune system to recognize the toxin before it can harm you. That's why doctors recommend booster shots roughly every 10 years. If you're vaccinated, your body can neutralize the toxin before symptoms even begin. And tetanus bacteria still exist in the environment everywhere, especially in soil and outdoor spaces, which means that rusty nail accident in the backyard or construction site still has the potential to turn into a serious medical emergency. And that's exactly why doctors take puncture wounds so seriously. Even if the injury looks small on the surface, the damage underneath could be the perfect hiding place for bacteria. But tetanus isn't the only reason stepping on a rusty nail can become dangerous. In fact, there are several other hidden risks doctors worry about when someone walks into an emergency room with this exact injury. Because tetanus isn't the only threat hiding behind a simple puncture wound. When a nail pierces the foot, especially through a shoe, it creates a deep and narrow tunnel in the tissue. On the surface, the injury might look tiny, sometimes barely more than a dot. But beneath the skin, bacteria can be pushed deep into places where your immune system has a harder time reaching. And one of the most common problems doctors see after nail injuries is serious bacterial infection. Think about where nails usually are: construction sites, old wooden boards, barns, garages, backyards. These places are full of bacteria, not just tetanus spores, but many other microbes that thrive in dirt, moisture, and organic material. When that nail enters the foot, it can carry those microbes straight into the tissue. Once inside, they begin multiplying. At first, the symptoms may seem minor. The area might feel sore, a little swollen, maybe warm to the touch. But within a day or two, things can change quickly. Redness spreads around the wound. Pain increases. Pus may begin forming. Fever can appear. At this point, doctors worry about cellulitis, a bacterial skin infection that can spread rapidly if untreated. And in some cases, the infection doesn't stop at the skin. It can travel deeper, into the muscles, into the joints, and in rare cases, even into the bone itself, a condition known as osteomyelitis. Bone infections are extremely difficult to treat and often require weeks of antibiotics, sometimes even surgery. But there's another surprising factor that makes stepping on a nail particularly risky: your shoes. Specifically, rubber-soled shoes like sneakers. Many puncture injuries happen when someone steps on a nail that goes through the bottom of their shoe before reaching the foot. And strangely enough, the inside of a sneaker creates the perfect environment for a bacterium called Pseudomonas. This bacterium thrives in warm, moist places exactly like the inside of athletic shoes. So when a nail passes through the shoe and into the foot, it can carry Pseudomonas bacteria directly into the wound. Doctors know this pattern well. In fact, when someone arrives at the emergency room with a nail puncture through a sneaker, physicians often choose antibiotics that specifically target this bacterium, because untreated Pseudomonas infections can spread quickly and become serious. That's why medical professionals never treat puncture wounds casually. Even if the injury seems small, the hidden damage underneath can become a problem days later. So what should you actually do if you step on a nail? First, don't ignore it. Clean the wound immediately with soap and running water. This helps wash away dirt and bacteria before they settle deeper into the tissue. Next, check how deep the puncture is. If the nail went deep, if the wound is dirty, or if you're unsure about your tetanus vaccination status, you should seek medical care as soon as possible. Doctors may recommend a tetanus booster shot, especially if your last one was more than 10 years ago, or sometimes even 5 years ago for certain injuries. They may also prescribe antibiotics if the wound has a high risk of infection. And most importantly, they'll monitor for warning signs over the next few days, because infections from puncture wounds often take time to appear. If you ever notice increasing redness, swelling, warmth, severe pain, drainage, or fever, those are signals your body may be fighting a growing infection. But the reason we've all heard that warning growing up, "Don't step on rusty nails," isn't just an old myth. It's a reminder rooted in real medical history. A tiny puncture wound can open the door to bacteria your body was never meant to fight alone. And sometimes, the smallest injuries carry the biggest risks. So the next time you're walking through a construction site, an old shed, or even your own backyard, it might be worth watching where you step. Because something as small as a rusty nail can trigger a chain reaction happening deep beneath the surface. If you enjoyed learning the science behind everyday dangers like this, make sure to subscribe for more fascinating explanations about the hidden risks and mysteries around us. And if there's a question you've always wondered about, drop it in the comments. It might become the next video.